Hi, welcome back to How to Medicate, and welcome to this video on carpal tunnel syndrome. This video is meant for patients or laymen, and I will explain it in easy to understand language. Also made a more in-depth version. If you're interested in that one, you can find it in the description. If you're meeting for the first time, my name is Raoul. I'm a medical student from the Netherlands and I'm making weekly medical videos to educate myself and you. So if you're interested, feel free to subscribe. Before we start, I always do a little disclaimer. This video is meant purely informational. This is not medical advice, and if you're looking for medical advice, always contact your own doctor. So now let's get into it. And this brings us to the slides. Before I will explain what carpal tunnel syndrome is, you need to know what the carpal tunnel is. In a nutshell, the carpal tunnel is an anatomical compartment at the base of your hand palms. And in both hands you have a carpal tunnel. The carpal tunnel houses the median nerve. And this is a very important nerve that innervates your thumb, index finger, middle finger and a part of your ring finger. It gives it sensation so you can feel with your fingers, but it also innervates the muscles in this part of your hand. So it makes you able to grab something and have strength in your hand. So it's very important. When you have carpal tunnel syndrome, this is caused by compression of this nerve. Because nerves don't like compression, and when they are compressed, they get damaged. Depending on the country where you live in, approximately 5% of all adults will develop carpal tunnel syndrome. Women are more likely than men to develop it, and it's important to note that within 1 year after you have your first symptoms, more than 33% of all people will be symptom-free without treatment. So that's important to note. There are certain risk factors for developing carpal tunnel syndrome, and all those risk factors have in common that they increase the pressure on the nerve, and as I already told you, pressure will damage it. So obesity might contribute to more pressure, as well as repetitive wrist movements. So certain jobs where you're moving your wrist all the time will more likely be damaging your median nerve. Also pregnancy or genetics. If your parents had carpal tunnel syndrome, you're also more likely to develop it yourself. Rheumatoid arthritis, diabetes, and lastly also thyroid problems can lead to carpal tunnel syndrome. And this brings us to the symptoms. If you have carpal tunnel syndrome, you will have symptoms in your thumb, index finger, middle finger and ring finger. And this is the case because the nerve innervates those fingers. First, your symptoms start gradually during nighttime, but they can get worse and worse, so you can also have symptoms during the day when they're more severe. You will have pain in the fingers, a burning sensation, you can have numbness and a tingling. So gradually the symptoms can get worse. In more severe cases, the pain will not only be located in your fingers, but might extend all the way up to your arm. It can also weaken your grip, and you can have loss of manual dexterity, which can make it hard to perform certain jobs. And in more than 50% of all cases, people have carpal tunnel syndrome in both hands. And how can you diagnose carpal tunnel syndrome? You usually go to your doctor and he will ask you several questions and perform a physical exam. Your signs and symptoms are very important for the doctor to see if you have carpal tunnel syndrome. If he suspects that you might have carpal tunnel syndrome, he might send you to a neurologist, and those can do electrodiagnostic tests. Then they see if your nerve still works properly. Another test that can be performed is an ultrasound of the carpal tunnel itself, so they can see if your median nerve is damaged. Then, if you have carpal tunnel syndrome, how do you treat it? The first step always is conservative treatment. Try to minimize the wrist movements you're having, try to take good ergonomics and start physiotherapy. This all can help a lot. However, if this is insufficient, you go to the next step, medical treatment. Often an injection with certain medicine, which is called corticosteroid, is placed in the carpal tunnel. And this can help to decrease the infection and irritation of the nerve and reduce the symptoms you're having. So it usually works for several months, up to maybe a year, depending on how you react as a person. Now lastly, if this is insufficient, you have also a surgical option. It's called a carpal tunnel release. Then you release the carpal tunnel through an incision in the hand, and this will reduce the pressure on the median nerve and therefore reduce the complaints you're having. It's a small surgical procedure, but it always comes with a risk. Risk of infections, risk of bleeding. So it's up to your surgeon to determine if you're the right patient for this treatment. In a nutshell, this was my video on carpal tunnel syndrome. If you're looking for a more in-depth version, you can find it in the description. And if you have any questions, feel free to ask them in the comment section. As always, thank you for watching. Subscribe for more upcoming videos. I will be posting weekly. And thank you. See you next time. Bye bye.